Welcome to Sex on the Floor podcast. This podcast was created to help educate the public about problems with sex and intimacy and how this is tied to both physical and mental aspects. Hosted by myself, Dr. Molly Hart, a passionate pelvic floor physical therapist and owner of Pelvic Balance Physical Therapy, and by Dr. Katie Schubert, a phenomenal sex therapist and owner of Cypress Wellness Center. We are here to have a good time. We're here to keep it real with you all and to educate along the way. I'm so excited for you to join us. We strive to help many relationships prosper in fun, safe, and healthy intimacy. While listening to the show, please remember that this information is not meant to diagnose or treat any medical conditions. Please speak with your medical provider for all things related to your healthcare. Hello, guys. Welcome back to Sex on the Floor podcast. This is Dr. Molly Hart.
And Dr. Katie Schubert.
So today what we're going to do for our episode, I think it's going to be kind of fun. So we're going to do a series right now on pregnancy and overall pelvic health for pregnancy. So to start us off, this episode is going to be about what to do to prepare for pregnancy as far as your pelvic health goes. Next episode, we're going to talk about what to do while we're pregnant. And then we'll do an episode about pelvic health in our postpartum state. So buckle up, let's get going. I'm really excited for anyone who's listening. If you are in this phase of life where you want to get pregnant, and hopefully you can use this information to keep your pelvic health so beautifully in a good state to where you don't even need to come see a pelvic floor therapist. That would be great. So what we're going to hit on today is I want to talk about birth control. I want to talk about food. I want to talk about stress reduction habits or habits that help you stay in a more calm state of mind. And then, of course, we're going to talk about exercise overall and how all of these affect our pelvic health before we get pregnant. And Dr. Katie will obviously help us out a lot with the stress reduction habits and so forth that we're going through. Okay, so let's talk about birth control real quick. If you are planning on getting pregnant, one of the most important things that I try to advise all the women I work with is that you really want to get off of any type of birth control, besides condoms, of course, but anything that's physiologically affecting your hormones as a female at least 6 months prior to getting pregnant. It will often delay when we're on birth control. Let's say we stop taking it and we're expecting to get pregnant, the next month or two. Very often it will delay being able to get pregnant that quickly. So we want our body to get in a nice natural hormone state, not artificially altered from the birth controls that we're taking. So that way the body has an easier time being in sync and being able for you to be able to even track, when am I on my period? When am I ovulating? Different things like that. And of course, go on.
I have a question about that. So, is it just that? Is it just that you have more difficulty tracking ovulation if your hormones aren't in a natural state, or is it that stuff is like stored up in your fat, like you hear?
So for me, here's my viewpoint. There's probably way more research on this that I'm not going to hit on in this episode, but the human body is so beautifully perfect already. It is so beautifully perfect already when you just leave it alone and you just let natural things occur. And so I will tell you, at this point in my life, I'm hugely not pro birth control anymore. I used to. I've been on birth control. I was on birth control my whole life from like 16 until 25. And then it started affecting my blood pressure. I had to get off of it, went on a different one. And then it really messed up. I got depression. I gained weight. Like I had all these problems happen because of birth control. And I'm a very healthy person. And so being in the pelvic floor world, I deal a lot with women who are on birth control, especially with endometriosis. They put all women typical Western medicine puts most women with endometriosis on birth control, which I think is a horrible way to manage it, but that's what they do. And so I've just seen all these problems that it causes women when we artificially mess with our natural cycle. When we're trying to get pregnant, one thing that we really, really know is if you keep your body in a nice, natural, healthy state, it is so much easier to get pregnant. It just naturally occurs. Now, when women are really stressed out and have a lot of anxiety going on, they've got all these different medications in their body, they're not eating well, it's extremely hard for them to get pregnant. And so once you start to naturally correct those things, it's really easy for women to get pregnant. So it's not even just about the cycle, but for me, it's just like, let's just let our body get in its natural rhythmic state, because for pregnancy to occur, so many things have to go right in the hormonal system of the body. So that's my viewpoint on it. I don't know. What are your thoughts?
I have no idea. I mean, I work with a lot of clients who are trying to get pregnant and can't, and have been trying like naturally for a year or two. I just, I don't know enough about the human body and the physiology of getting pregnant and what it takes. I do know though that what I hear from a lot of my couples is, well, we're giving up, we're not gonna try. The stress, is reduced, and then they get pregnant.
Yeah.
I don't know if that's like a fluke or if that's because their stress is reduced and therefore
I think it's because stress is reduced. I have a patient right now that's so she's actually not a patient of mine anymore. She's older and was doing IVF, donor egg, couldn't get pregnant because she was doing the typical IVF pathway where they just like inject you with so much hormones. So you know what she did recently? And she's pregnant, by the way, now. And I think she's in her like late 40s. Like I don't know how old she is. I think late 40s. She did donor egg natural. She just did acupuncture, worked with an acupuncture physician, didn't do any of the hormone. I don't know how she did this. I don't know what physician allowed her to do this. Got pregnant. This was like her last attempt that she was going to try, and she finally got pregnant. So I don't know. I'll stop going on that rant. But the biggest thing is with pregnancy, when we're trying to get pregnant, is we want our body to be in a more natural state. And so we want to get rid of anything that's altering our hormones as best as we can. And that obviously goes for other medications that we might be on as women. So we can kind of catalog now, go into stress reduction. Obviously, women who are dealing with depression, stress, and anxiety, they may be on medications to manage that. And then we know when we're pregnant, most of the time, not always, but most of the time, you cannot stay on those medications. And we want to find new strategies, lifestyle habits that we can hopefully pivot onto even before we're pregnant, so we can try to detox our body of those medications, and also just to gain those new habits before we get pregnant, because otherwise you're going to be pregnant and not have anything to like piggyback onto. So is there anything you want to touch on that, Katie?
It's so complicated, because then you have to, what I'm thinking of is, the partner who's involved also. So that's when I like to bring both partners in and, help teach the partner that doesn't have depression or anxiety how to facilitate a happy life for the person with depression or anxiety, or how they can best support them. So
that's great, actually.
Yeah, it's really complicated, if they are partnered. But yeah, that's my 2 cents on what you just said. I don't know. Again, I don't know the mechanics of, what the medications do enough to know why people go off of them when they get pregnant.
And some, like I have a friend who, I don't know what she was on. I don't know if it was Xanax. I can't remember what it was. I know I have friends who do stay on their antidepressants and stuff when they're pregnant, and their baby's perfectly fine. And they have to do that because otherwise the anxiety or the stress that they're under would be more of a risk to them in the pregnancy than being on the medication. So it's something you just have to work with your doctor on. Yeah. But let's go. Why does this have to do with pelvic health? Why does stress and anxiety have to do with pelvic health? So when we are stressed out, we automatically engage our pelvic floor muscles. We're not aware we're doing this. And a really good example of this is if you have a dog or you have a friend who has a dog and you've seen a dog before that is in a stress response. Let's pretend there's lightning, there's maybe fireworks, there's thunder, or the dog's in trouble. If you think about the positioning that the dog puts their body in, they cower. And so they kind of tuck their head, they lift their shoulders up, and they tuck their tail. And so we as humans do the exact same thing with our body when we are in a stressed, anxiety-provoked position. We kind of do the small body posturing like that. So a lot of people who have a lot of stress and anxiety will report that they have neck and shoulder pain. Well, why? Because they're overactivating these upper muscles here. They're not aware they're doing it. It's just a natural kind of physiological response. Well, the other thing that we know they're doing from the research is that they're engaging their pelvic floor muscles. Well, why? Why the pelvic floor muscles? The pelvic floor muscles, all of them attached to your tailbone. So we don't have a tail like a dog does, but we do have a tailbone. And so when we're in a stress response, we contract all of our pelvic floor muscles to tuck that tailbone. And again, like I said, we're not aware we're doing this. This is just something that's physiologically happening. So my patients who have a lot of stress and anxiety, when I go to work on them, I don't even put that much pressure on their glute muscles or kind of buttocks tissues, and their whole butt muscle will contract, the hamstring will contract, of course the pelvic floor muscle is contracting, and they're constantly going into this contracted, relax, contract, relax state. Whereas somebody who has a nice healthy pelvic floor, that's not happening. They can stay in a nice relaxed state. So that's one factor with pelvic health, why stress and anxiety is a factor. And then overall, really with the human body in general, especially with pelvic health, but I'm just going to talk about global health, is this is the way my brain works. We always want to think about the body and how often am I in what I call sympathetic nervous system mode versus parasympathetic nervous system mode. So our nervous system is broken up into multiple layers that I don't want to get into here. I don't want to confuse anybody, but one part of it is our automatic system. So it's not our voluntary system. It's just automatically happening. That's what's allowing us to pump our heart and to breathe and to go pee and all these things. And that automatic system is broken up into two systems: our sympathetic, which is our go, 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 fight or flight, and then our parasympathetic system, which is our calm, relaxing, rest and digest, healing mode. And the human body kicks ass when those two systems are in a nice unison balance. It just operates beautifully. But when we are in sympathetic mode too much, which is a lot of people in the American culture, because of the way our culture operates, it like teaches us to be in sympathetic go, go, go mode all the time. When we start to get an imbalance between those two systems, things start to get really haywire in the body, and we start to present with all these really weird symptoms. Those symptoms can be back pain, it could be a rash, it could be psoriasis, depression, it can be thyroid. Thyroid dysfunction is probably the number one. I have hypothyroidism. All these different things start to happen, and then our medical system just like looks at that one little baby system and they're like, oh no, like you have thyroid dysfunction, let's just treat the thyroid. And it's like, no. Why is the thyroid system messed up? Well, because our parasympathetic and our sympathetic system are not in balance. And so it's affecting the entire endocrine system. Our hormonal system is now imbalanced, and now the thyroid's getting damaged. So with pelvic floor dysfunction, a lot of the times what I'm seeing is this chronic time frame of being in high sympathetic mode all the time and not the body not knowing how to be in a restful state. And so that also leads to that pelvic floor muscle always being engaged and so forth. So before we get pregnant, from a pelvic health standpoint and just from a global health standpoint, I think one of the most important things that we can ever do for ourselves is to learn how to be in a more calm state of mind more often than most of us allow ourselves to be in that state of mind. And I know, Dr. Katie, I know you work so much with your patients on this. Mm-hmm. Like, could you go through what you even have at your facility, like stuff that you're using to help?
I mean, some of it we talked about prior to hitting record. So exercise is big, having downtime, having hobbies, having things that you enjoy doing. The thing that I was thinking about when you were talking about the parasympathetic and the sympathetic systems is that often I hear couples that, couples come to me because they're not having sex, or they have no sex drive, or they have mismatched sex drives.
Yeah.
And I always ask about, okay, well, what has your sex life looked like for the past year or two? And usually what I'll hear is when we're home, when we're doing our thing, when we're, working our routine, we're not having sex. And I always ask, well, what is your sex life like when you go on vacation?
Yeah.
And they say, well, it's great. It's like it was when we first met. So, that just kind of reinforces what you were saying. If people are in this rested state, they're able to acknowledge, what their body wants, what their emotional states want. And usually people who go on vacations have better sex.
Yeah, you do.
Yeah, I think
and
that
libido's higher. So we know libido is tied. So it's interesting because sex itself, it goes between both of these modes. But actually having a libido is tied to parasympathetic mode. So people who are really good at being in a more calm state of mind have a higher libido, which makes sense because they're able to relax. And then women who are really good at it, they like to masturbate way more because, let's face it, masturbation is super fun. And that's a great way to be in your parasympathetic mode and just to kind of be calm and please yourself. So if we're trying to prepare for pregnancy, if you're always in this go mode, not only is your body going to have a hard time getting pregnant, but it's also going to be hard to even prioritize time to have sex and to enjoy what's going on. So quick little things on that. I think we've touched on this in past episodes, but things that are really, really easy for us to work on when it comes to being in a more calm state of mind is obviously meditation. Is probably my favorite thing that we can do. And when I say meditation, it doesn't need to be like an hour-long thing. It can literally just be 5 to 10 minutes. I tell all of them I work with I call it microdosing throughout the day. We microdose calmness throughout the day because a lot of us maybe don't have a whole 30 minutes or a whole hour to be in a restful state. So when you go to the bathroom, I love the bathroom. Like when you sit in the bathroom, you're alone. I'm like, just put a timer on for 5-10 minutes and do some diaphragmatic breathing. Maybe you sit there and you have a guided meditation that you're able to listen to. Maybe you sit there and you just close your eyes and you picture yourself somewhere where you would love to be. Like maybe you just went on I always have my patients pick out like 2 really awesome past memories, which by the way, is so hard for people to do. They can easily pull up all the trauma, but to pull up like 2 really great memories, so hard for people to do. And I'm like, can you just kind of like relive that? Like go back in there, like let's pretend it's on the beach and like smell the breeze, hear the waves crashing. Just close your eyes and do that while you're sitting on the toilet. Throughout the day when you're go, can you just take 5 minutes to sit outside on the porch swing and just look at the trees blowing in the wind, hear the birds, maybe hear the cars going by. So you turn the to-do list off in the brain, which is so hard for us as moms and as women to do. But we want to turn that off for a moment and give ourselves the privilege and the ability to just be with our present time. So those are like real simple things that can help with that. And the more we get in that mode before pregnancy, the better, because when we're pregnant, you can't do a lot of things that people do. You can't drink anymore. You can't smoke. You can't take maybe other drugs that were being utilized. For me, I used to do hot yoga. I couldn't do that. I couldn't go in the hot tub anymore. It sucks. So all I had really was meditation. And I did a ton of meditation. I know myself when I was pregnant to calm my anxiety and to make sure I was sleeping, because it can get hard at times when you're pregnant. So before pregnancy, getting into these, learning how to be more mindful, learning to do more meditation, all of that is going to be key for global health, getting pregnant, and for your overall pelvic health. Anything you want to hit on, Katie?
Yeah. In terms of the meditation, what I like to have people do if they're anxious, if they're up in their heads a lot, I ask them to do things like body scan meditations where they learn to control each of their muscles, and they learn how to bring attention to specific parts of their bodies. And I've done this almost my whole life. And when I got pregnant, when I was in labor, it was super handy because I was able to really concentrate on the contractions and bring attention to what was happening with my body and stay calm instead of, freaking out because my body was doing this weird thing, this weird, painful thing.
I love that.
Yeah. So that's one thing that I would say. The body scan meditation, learning how to bring focus to each individual part of your body.
Yeah, no, same thing with pregnancy. I remember I had a pretend like almost eye or something right here that I just hyper focused on during my contractions to keep myself calm, because I didn't want anything to be lower. I didn't want to bring any attention down there. I was like, I'm just going to focus up here during the contraction. But one thing that's great is something called hypnobirth. There's lots of different programs out there. So many beautiful apps. There's one called Expectful. That's an app that has wonderful meditations on there for pregnancy. So, oh, my computer. Let me get my computer going. It's acting like it's going to die, even though it's plugged in. Mm-hmm. Give me 2 seconds. There it goes. Okay, I'm not going to touch it. All right, so we'll move on from that. Just the importance of that for pregnancy and so forth and pelvic health. Next thing that I want to hit on, let's hit on exercise right now, because that's going to be a huge part of this. So before we get pregnant, I would say start doing your Kegels immediately. You can do Kegels before pregnancy, you can do Kegels during pregnancy, and you can do Kegels immediately postpartum. We want to be doing them the whole time, because that pelvic floor is getting a lot of stretching that's happening at it while we're going through these phases. Interesting study. I need to find the study and probably reference it on here. They did a study on women who are very active and work out all the time to see if they also then had a strong pelvic floor. And I thought for sure they would find, oh yeah, women who just naturally are strong and working out would just have a nice, strong pelvic floor. And they actually did not find that. They did not find a correlation between women who are really active and the fact that their pelvic floor was strong. So what it really came down to is like, we have to prioritize the pelvic floor and make sure that we have good control. Another thing is, just like kind of what Katie was saying a moment ago, focusing on the body, being mindful of contracting certain muscles. If you're able to be really in tune with your pelvic floor muscle, that will help you tremendously when we are going through the labor process. So the pelvic floor muscle, can we squeeze it, but also can we release it? Can we let it relax? Are we able to calm our body and not be, remember I told you when we're stressed and anxious, what's the pelvic floor muscle doing? It's contracting. So women who don't have the ability to connect with the pelvic floor and to stay in a calm state of mind aren't going to be able to really relax the pelvic floor and bear down, lengthen it, which is really needed when we are trying to give birth.
So Molly, I have a question. So the epidural.
Oh, right? Yeah.
Like, are you, because I got an epidural and I had, that the mind body connection I was talking about. Yeah, nothing. I pushed and they told me to push, and I relaxed and they told me to relax. Yeah.
So I actually, in a weird way, I kind of love this. I did most of my birth without an epidural. I wasn't planning on it. I had a totally natural birth and it was great. I was in the hot tub at a birth center. It was heaven. But then my daughter was sunny side up and entered the birth canal obliquely. And I was in second stage labor for 3.5 hours. So that's fully dilated. Second stage labor should last only 30 minutes to 2 hours at most. So I was at 3.5 hours, I was considered prolonged second stage labor. And I waddled my butt out of there and went to the hospital at that point against my midwife's and my husband's desires. And I told him to screw off. And I was like, I'm done. Because my daughter was literally in my vaginal canal at this point. That's why I say I waddled out. So I got to the hospital and did get the epidural, and wow, what a weird feeling. It was great. It was heaven, actually. But yeah, you can't feel. So yeah, that really stinks, that you can't feel and connect with your body. But I think with all women, when it gets to that point, that you need to assess, here's what you need to assess. If you're somebody who's really good at connecting with your body and getting yourself in a calm state of mind, because you've practiced this before pregnancy and during pregnancy, and you feel that confidence, I would tell you, your body is incredible and amazing, and don't be afraid to have birth without an epidural. You'll be okay. I would say definitely try to find a spot that can have a hot bath. Birthing in the bath was so I like, once I got out of the bath, I hated it. But when I was in the bath and with the water, it was great. And I did use the gas, the nitrous gas, which was okay, but I think that slowed down my contractions quite a bit too. So I don't know. And that does make you feel like you're a little high. But if you're a woman who's not confident in your ability to stay calm and to be relaxed, then honestly, you might want to consider doing the epidural, because otherwise your body's going to be fighting against you during a lot of it. And I just think every female needs to worry about that themselves. But yeah, ideally, can you feel more and everything is going to operate in a much smoother direction if you can feel it all? Of course. But not everyone wants to feel everything. What are your thoughts?
I didn't want to feel everything.
Yeah. So
but it was fine. I mean, I wasn't able to have him naturally anyway. I got a C-section. So yeah. I don't know what the ending would have been like, but
I kind of loved mine. I was like, you do all the birthing naturally. And then at the very end, when the baby's about to come out, which they call it the ring of fire, that's supposed to be like, that's when I got the epidural. So I was like, heck yeah. And then of course I tore and they just stitched me up and I didn't have to feel any of that. And just got to connect with my baby. So I'm like, maybe next time I'm going to birth like that. And then I'll get the epidural last minute again. It was kind of great. Anyways, with the pelvic floor, I have on my website, if you go to pelvicbalancept.com, I have an area that says free resources. And on there, it says Kegels 101 handout. Download that handout and follow my 12-week program. You'll see at the very end, I want you to start doing your Kegels with working out. But in the very beginning, I have you doing it really basic. You're just laying down and you're sitting. And then we slowly progress that to then sitting and standing, and then eventually standing and exercise, and then eventually just doing it with your exercise. So you have to slowly do that, because if you go too quickly, too rapidly into your exercise program, just like any other muscle, you're not going to get very good results, and you're over challenging the muscle, and it's not then having a good contraction. I just had a patient in here who has I think she's had 6 children, 6 vaginal births, and super, super weak pelvic floor. And I had her in sitting for the first time today, and her contraction quality was so bad in sitting. And then as we kept going, we did 2 minutes. The first minute was okay. The second minute was awful. And what happens sometimes, not always, when people have a really weak pelvic floor, is then the muscle kind of stays activated. And so she couldn't really fully relax. And so she's trying to contract when it's not fully releasing. And so now we're training the muscle in this very bad pattern. And then that can lead to a muscle that's in this more tight, contracted state versus a nice, healthy muscle. So you want to go slow with your Kegels. If you've never done them before, start with the very first week I have on there and then slowly build up. And then once you get to the exercise portion, just do that for the rest of your pregnancy. You don't need to overdo Kegels. I would say 3 times a week is great, unless you're having a problem. Now, if you're a woman who's having a problem, like you're having stress incontinence, you're having a prolapse type symptom, which is where you have like a lot of pressure down there, well, then you want to do more than 3 times a week. But if you're not having any issues, 3 times a week is enough. Don't overdo your Kegels, because overdoing your Kegels can also lead to some discomfort and can even lead to some tailbone pain. Because when we contract the pelvic floor muscle, your tailbone is sitting on the back side. And when you contract it, it flexes the tailbone up. And that's a little joint right there. And so think about this. So if we start doing squats together, Katie, you and me, we've never done squats. We're going to start doing squats together. If I overload my squats, you and me do it, what do I think is going to happen to my knees? Are my knees going to be happy, or do you think they're going to get kind of PO'd at me?
They're going to be mad.
You're going to get mad, right? Because my knees can't tolerate that amount of weight on them. So that joint, it can eventually if I slowly pace into it, but they're not going to be very happy if I start doing this crazy amount of weight. Your tailbone is the same way, that little joint, that coccyx joint. So if we start overdoing Kegels, what I'll find with women, and even myself, this has happened, you'll start to get a little bit of tailbone pain back there. So if that's happening, don't be scared that that's happening, but just know that means you need to back off and you're overloading that joint right now, and you need to slowly pace back into it. We know from the research that women who have a strong, healthy pelvic floor prior to pregnancy and during pregnancy, significantly lower rates of stress incontinence, significantly lower rates of SI joint back pain, lower rates of prolapse. So you really prevent yourself from having prolapse issues. We also find that you tear less, believe it or not. So you actually have more success with the birthing process and less of an issue with tearing. So a lot of people are like, oh, my pelvic floor is really strong like that, does that mean I'll tear more? No, because it's not about being strong and short. It's about being strong in the nice full range of motion.
Yeah.
If you feel like you don't know what you're doing with this, no problem. Go see a pelvic floor PT and do maybe a couple sessions to where you feel confident with what you're doing, and then go home and execute the program. It's really not hard, but if you're not confident, then just go get an assessment real quick so we can train you and give you the confidence that you need for these types of contractions. So before pregnancy, we absolutely want to be doing a Kegel program. Again, like I said, it's on my website if you guys want to look that up. Last thing I want to touch on real briefly. Is there anything you wanted to add to that, Katie?
Not to that, no.
Okay. Last thing I want to add is food and also the products we're using for pregnancy. So when we are trying to get pregnant, it is this is, perfect world. In a perfect world, we want our partners and us to be eating a much healthier diet. What's a healthier diet? More whole foods. So high vegetable content, about a cup or so of fruit a day, having about a fourth of a cup of nuts or something, nuts and seeds. Seaweed is another great thing that is phenomenal for us, the nutritional properties in that. If you are able to tolerate the taste of it, I love seaweed. Mm-hmm. And then nicer quality, if you're able to afford it, nicer quality organic meats, grass-fed meats, things like that. So we don't have all these antibiotics, all these nitrates, all these other contaminations in our body. If we're eating a lot of processed foods and we're eating a lot of processed foods and just also not getting in these more high quality foods, you're depriving your body of these nutrients, and your body just isn't going to operate as well. So I tell people this all the time. This is probably like my favorite analogy. If you take a flower, so we have a garden and we just planted all these beautiful flowers, and my flowers are starting to look like they're dying. So maybe like in some of the plants, like the leaves are curling up. Some of them, it's getting droopy. So maybe some other ones they're getting discolored. We don't rip those plants out of the ground and bring them to the doctor and say, hey, can you do some blood work on this? Can you do that? Like, what do I need to inject into my flowers to make them healthy? We don't do that. That's crazy, right? That'd be crazy. No, we go, have I been watering my plants enough? Do my plants get enough sunlight? Do my plants get enough nutrients? So do I need to put some more nutrients into the soil? It's that simple. It's just sunlight, water, and nutrients. And most of the time, if you address those three basic things, you can make that plant come back to life and look beautiful again. It's the same thing with the human body. So when your body is not able to get pregnant, or it's having issues and you're having odd signs and symptoms that are occurring, instead of, focusing on all these things that what's wrong with my body? What do I need to fix? This small little thing, just go back to the basics and just make sure we're getting plenty of water. Make sure we're getting our body plenty of nutrients. Like food is our nutrients that our body has to have in order to operate and function properly. Okay, so there's my little rant with that. Obviously, if you and your partner are both on board with that, I think that helps significantly, because that does affect men's sperm and their sperm count and so forth. Last little thing I want to plug before we're done with today is I've worked very closely with registered dietitians with my patients. And one thing that any good registered dietitian will tell you is that women who are struggling to get pregnant, not very often, some of the times the thing that makes everything better is changing all of the chemicals and products you're using at home. So a lot of the stuff that we use on our skin and the things we use to clean with are endocrine disruptors. So it affects our endocrine system, our hormone system. And again, going back to the beginning of this episode, we want our hormone system to be in balance. So if you're trying to get pregnant and you're struggling and you're finding there's an issue, even if you're not struggling, be really mindful of the makeup that you're using on your skin. I personally use Beauty Counter. It's pricey. It's pricey to live a healthy life. My goodness. But I personally use them, and there's other ones. There are websites out there. I wish I had the name of them. There are websites out there that you can go on and type in whatever product you have, and it'll tell you like the quality of that product and if it has a lot of endocrine disruptors in there or not. Do you know what I'm talking about, Katie?
I don't really wear makeup. So
no, okay. Well, good. That's actually probably better.
I was going to say one other thing about what you were talking about. A good multivitamin goes a long way too.
Oh, yes. Oh, gosh. Yeah. Multivitamin, fish oil, and then a vitamin DK supplement. Yeah. Thank you. Those are some that all women should be on prior to pregnancy and during pregnancy and postpartum.
I think it's important to say that too, because going back to what we were talking about initially, like, don't get yourself worked up about this, right? Like, if you feel like you don't know what kinds of foods you need or how to have a balanced diet, go to Target and get a multivitamin.
Yeah.
And that will cover a lot of what needs to be covered.
Yeah. And also, I would tell you, if you're able to, if your insurance allows you, just work with a registered dietitian. Yeah. So registered dietitians are so much more educated and far more superior in their intelligence when it comes to nutrition than any doctor you will work with for the most part. So if you're going on this journey of becoming pregnant, don't try to figure it all out yourself. Just use your insurance, get a registered dietitian. They'll tell you what supplements to be on. I'll be honest, I don't buy anything at supplement wise online or at a grocery store because they're not vetted very well. So my registered dietitian has an entire portal that she psychotically researches and vets, and she just tells me what to buy, and I buy whatever she tells me to buy. So if you're not sure about your nutritional intake, just work with a registered dietitian. It's that simple. Don't try to figure this all out yourself. So that's it. Prior to pregnancy, from a pelvic floor physical therapist, these are the things that I like to educate women on. If you guys have any questions on this or any feedback, please email us, let us know. And we are super excited to see you at the next episode where we're going to talk about pelvic health while we're pregnant. All right. Bye, guys.
Bye.
We are Dr. Molly Hart and Dr. Katie Schubert, and you've been listening to Sex on the Floor podcast. We really hope that you enjoyed this episode. If you have any questions and want to get in contact with us, you can follow us on Instagram at Dr. Molly Hart and at Dr. Katie Schubert, on Facebook at Pelvic Balance PT and at Dr. Katie Schubert. And for more information about us on our websites, you can find us at pelvicbalancept.com and at drkatieschubert.com.